Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today you're going to learn about something called Integrative Medicine. My guest today is Dr. Jeanine, an integrative medical specialist and the chief of Integrative Medicine Service at Memorial Sloan Kettering Cancer Center. Dr. Mao, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you for having me.
Let's start by asking, how would you define integrative medicine?
Integrative medicine is a patient-centered, evidence-informed way of treating patients with health issues. We incorporate lifestyle modifications, mind-body treatments such as acupuncture, yoga, or meditation, and appropriately address herbs and supplements in the context of a conventional care, such as conventional prevention, treatment, and I do a lot of work with cancer patients, so that would include conventional cancer treatment.
What made you want to get into this specific type of medical field?
So I was trained in family medicine. So after my training, I realized a lot of the tools we have in our toolbox, like medications or injections or procedures, are really important and helpful, but they don't help everything, such as for example, pain is a good example. I find a lot of patients are trying all type of pills, are still in so much pain. So I went out to seek training in acupuncture, and then over time incorporated other integrated approaches. So when I started my career, that was 20 years ago. That's approximately how old this field is. So sort of like over time, there is really a cadre of colleagues working together, trying to do research and build this type of practices in the setting of hospitals.
So in the combination of this mind-body yoga herbs, it's mixed with European medicine?
Yes. So we try to really carefully evaluate the patient to determine when and where it's important to introduce or in your way mixing, because it's not just a sort of random use, because in some aspect, like the conventional medications or surgery is really the best, maybe the only way to go. In other settings, I think allowing patients to try acupuncture or do some yoga or even try some herbs may be safe and a better alternative.
Are you surprised about the buy-in that the average patient has to acupuncture, acupressure, yoga as a means to treatment?
Yeah, so in the United States, there is a documented increase in interest and use of this type of therapies by patients. In large survey study, about 1 in 2 patients utilize this type of approach. In part, it represents, I think, 2 major issues. One is we are very good with curing a lot of deadly illnesses, such as heart disease and cancer. So people are living longer. They also desire better quality of life. So I think a lot of the patients don't want to take another medication that is caused by another medication. So they really want to try something more holistic and natural. The second aspect is also there's a growing movement in sort of a consumerism. Patients want to take more control of their health. That's in parallel, you also see the rising interest in exercise, nutrition, weight loss. So patients really want to focus more on prevention rather than just develop chronic illness and then manage reactively.
So tell us more about your role at Sloan Kettering. What is your average day like?
It's a good question. I have a very rich and kind of exciting job. Like I'm the service chief of Integrative Medicine Service. So I I see patients. So in my medical visits, I a lot of time doing telemedicine consultations, really trying to understand what patients' sort of a medical and health history, and then help them to guide to incorporate complementary therapies into their care. I am also a physician acupuncturist, so I see patients using acupuncture to treat symptoms like pain, neuropathy, hot flashes. And I also am a very active researcher. I have a lot of funding from the National Institute of Health and Patient-Centered Outcome Research Institute to try to really build the evidence base for integrative therapies such as, acupuncture, massage, music therapy, yoga, to really help them to have the sort of evidence base to support the safety and efficacy for addressing specific symptoms and challenges of our patients. Last but not least, I am so honored to work with a group of close to 60 integrated health providers and researchers. This including, acupuncturists, massage therapists, fitness instructors, and mind-body therapists. So, and creative arts therapists like music and dance therapists. So together we take care of patients, both inpatient and outpatient, and so really support patients' physical, emotional, and spiritual well-being along their cancer journey.
So you mentioned research. Has the research shown that this integrative medicine is more, successful in patients who have chronic illness or cancer?
Yeah, so I think where we have the most evidence right now is in managing cancer-related symptoms, such as chronic pain. For example, last year, we published a large randomized clinical trial in JAMA Oncology, showing that among 360 cancer survivors with chronic pain, 2 forms of acupuncture, electroacupuncture and ear acupuncture, were better than usual care in reducing pain, improving functions and quality of life, and reduce the need of pain medications. Both short-term, but also surprisingly, we see the effects as very durable. Even 6 months after the randomization, that's like close to 4 months without any acupuncture treatment, the pain remain to be reduced and the pain medication use remain to be reduced. So with this type of evidence, actually recently, American Society of Clinical Oncology and the Society for Integrative Oncology just issued a joint guideline to recommend the use of acupuncture for chronic pain. So similar evidence also exists for example, meditation or yoga for anxiety and depressive symptoms or for fatigue in cancer survivors. So I do think there is growing amount of evidence that support where we can use this type of approach safely and effectively.
So just curious, were you a physician first or were you an acupuncturist first?
I'm a physician first.
Okay.
Yeah, I feel like actually when I finished my residency training, and I've known acupuncture, but I never thought I would use acupuncture. And until I started my medical practice, when I feel kind of helpless with my patients with chronic pain, other than just prescribing medications and sending them for imaging tests, sending them to specialists, and specialists will send back to me to say, oh, I've done all I can do with the patients. Here's the patient back to you with the same level of the pain. Mm-hmm. So I decided I need to really get some additional skills to help my patients. And once I started learning acupuncture, I really enjoyed this sort of blend practice of combining acupuncture with sort of traditional biomedical medicine.
Do you find that in treating cancer patients that their pain level is decreased and need less pain medication when you are incorporating acupuncture or acupressure?
I definitely see in my clinical population the needs for the use of pain medication can be mitigated. Especially, I think, in the setting of survivorship. I feel like, for example, when patients just had radiation treatment, they can have mucositis, right? Like their mouth is inflamed. There's so much pain. So often opiate is the easiest way to give to them. I think then when they're finished the treatment, ideally incorporate treatments like acupuncture can help reduce the pain, improving their dry mouth and improve their quality of life. And similarly, we've seen in patients with sort of a chronic musculoskeletal or neuropathy, often as their symptoms reduce, patients either reduce or stop to take their pain medication. However, with a caveat, I feel like for patients living with advanced cancer, if their cancer is the source of their pain, especially if the cancer continue to grow, I think that's where you also want to realize where is the strength limit. I do think opiates play a huge role and in managing pain, and I think the patient and the family shouldn't be afraid to work with their doctors to take appropriate opiates to control their pain.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about something called Integrative Medicine with our guest, Dr. Drew Mao, an Integrative Medicine specialist and a Chief of Integrative Medicine Service at Memorial Sloan Kettering Cancer Center. So, Dr. Mao, what is there a difference between complementary medicine and integrative medicine, or are they one and the same?
Jeanine, this is such a great question. There's actually a few different terminologies. So when we talk about alternative medicine, that's when you use things like herbs or acupuncture instead of conventional medicine. Actually, very few people do that. And then there's the complementary medicine. That's when patients just use on their own, right? Like a patient buy like some supplements from drugstore while they're taking hypertension medicine or antidepressant. That's what we call complementary medicine. So patient derived use. The integrative medicine is really is the process of having physicians or nurse practitioners or physician assistant to guide a patient to select appropriate use of complementary therapies for the right purpose in the right setting to address the right kind of problem. So that become integrative.
Have you found that patients that have come into your office or that you are treating do sort of like their own herbs, maybe because it's cultural, that are actually going against the medication regimen that they're on?
Yeah, this is a major challenge for our field is especially when we see cancer patients, a lot of their families and friends are so trying to help in any way possible. So the intention always comes from the right place, either from their cultural use or another friend has tried this. So often patients come to see us with, sometimes bags of supplements and herbs. But this is where the challenge of sometimes more is not always better, especially some, for example, chemotherapies and herbs will use the similar kind of enzymes or molecules to process the chemotherapy or the herbs. So then they compete with each other. So that could potentially decrease the efficacy of the chemotherapy, so decrease the chance we can find a definitive cure for the disease. In other settings, I would say a lot of cancer patients may be on blood thinners, and then if they're on herbs, also kind of promote bleeding, then that could also increase the risk for bleeding, which could also have negative impact. Last but not least, some of the patients with either cancer or chronic illnesses have a lot of kidney issues, liver issues. Some herbs do have kidney and liver toxicities, especially taking large amount. So they need to be super careful. So I do think just because it's herbs, just because it's natural, it's definitely not always safe.
Have you ever prescribed cannabis as a form of therapy?
So cannabis is receiving increased sort of attention by both medical community and also patients. I'm actually part of a large study funded by the National Cancer Institute to assess the usage of cannabis by our cancer patients. So there's definitely like a good 20-30% that the patients have utilized cannabis for a variety of reasons, such as pain, sleep, nausea. I do think in advanced cancer setting where symptom control, nausea, pain is a challenge, I do think there is value for medical cannabis. I personally don't prescribe it, but we do have a physician in my practice prescribe cannabis.
So when you're talking about cancer, I understand the cancer because you do work at Sloan, Kettering. However, is this integrative medicine also useful with patients with chronic illnesses?
Absolutely. In my early days of research, I've done research with people with sort of a chronic illness, such as chronic skin diseases or diabetes or heart diseases. We found the rates of complementary medicine use is pretty high, and nationally there's a National Academy for Integrative Medicine that is composed of many leading academic institutions such as Harvard, Stanford, University of Pennsylvania. So a lot of hospitals incorporate integrative approaches for treating other chronic illnesses. Especially, I would think for a disease like diabetes, lifestyle plays a huge role in regulating blood sugar control. So I do think integrative medicine can potentially play a role there.
So you talked about your team that you work with, which I think is very interesting. Acupuncture, acupressure, massage, mindful meditation, yoga. Do you also do Tai Chi?
Yes, we have a dedicated Tai Chi instructor to work with our patients. So, for example, we have virtual classes by the programming called Integrative Medicine at Home. So these are like 20 classes we teach over the Zoom. We started the program through the pandemic, and it turned out to be a huge success. So we have people from 23 states and 3 countries doing classes with us every week. And Tai Chi is a really good form of sort of mind-body therapies, combining breathing, posture, and some meditation. Particularly has benefit for improving functions and preventing falls in older patients. So I do think it's a really important tool in the box for us to not only for cancer patients, but also to promote healthy aging.
And how about music therapy? Is that also incorporated in your therapies?
Yeah, such a great question. So we all know how important music is to our health and well-being, but music therapy is a specific form of actually psychological intervention delivered by the means of music expression or music creation. So we have one of the longest music therapy team in oncology setting. So in the inpatient setting, we provide music therapy for both children and adults and their families, dealing with impact of cancer. So, for example, we just got a lovely note from a patient's husband as the wife was, passing away. So during the end of life, so our music therapist really work with the family playing the songs that help bring wonderful memory. Wow. And that process is very sort of healing for both the patient and the family. And a really exciting part is that we actually have a huge clinical trial funded by the Patient-Centered Outcome Research Institute. Is actually conducted virtual, so people from Long Island can also participate. It's comparing virtual music therapy versus a virtual psychotherapy for anxiety symptoms in cancer survivors. The goal is a lot of time music therapies are used predominantly in inpatient setting, but as we all know with the pandemic, there's a rising mental health issues and decreased access. We want to test, can virtually delivered music therapy be an effective way to increase resources for mental health? So this trial is currently enrolling patients, any cancer survivors who experience anxiety can potentially enroll in this trial.
That's exciting. So with all of these components of the therapies that are provided, are all of these covered under the insurance?
I think this is one of the biggest challenge for our field. Our physician consultation is covered by insurance. I think acupuncture actually nowadays is covered by some insurance. Like, for example, Medicare covers the use of acupuncture for chronic low back pain. But still, for other symptoms, not all insurance cover it. So it creates a challenge for patients who are from socioeconomically disadvantaged background. So I think there's still a lot we need to do to really build research evidence and then work with lawmakers to make some of these therapies covered.
Is it not covered because maybe it's not, the feeling is that it's not legitimate part of medicine? Why do you think it's not covered by most insurances?
This issue is particularly loaded.
Yeah.
I do think some that it may be because of the evidence of the research is not strong enough. Then I do think there is also economic forces, either for or against it. So I do think we need to find a solution, because a lot of time this type of quality of life programming is covered by philanthropy or research grants. And in order for it to really help to address patients' health and well-being, particularly for patients from disadvantaged background, I think we need more equitable insurance coverage.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about something called Integrative Medicine with our guest today, Dr. Drew Mao, an Integrative Medicine Specialist at the Chief of Integrative Medicine Service at Memorial Sloan Kettering Cancer Center. So, Dr. Mao, another question for you. Is there an age limit, right, to these therapies? Do you work with children as well as seniors?
So in our service, we have dedicated staff and physician work with children with cancer. So the answer is no. But certainly when we do therapies with children, we have to tailor the approach. For example, our dance therapy is very popular with young children, but acupuncture needles may not be the children's best friend, right? So for those children, we maybe use acupressure, like placing pressure at specific points. In terms of age limit, we don't really have an upper limit. Some of the patients we see or enroll in trials are well into the high 90s. Wow. So certainly I feel like having good quality of life, having better functions, really don't have an age limit.
Do you work with other oncologists?
Yes, it's really a team effort. We collaborate extensively with other surgical, radiation, medical oncologists in our research and clinical programming. For example, we have a study to help cancer patients going through active treatments. We're collaborating with medical oncologists from, lung cancer, breast radiation, head and neck cancer, melanoma, and gynecological cancer. And we have another trial working with our pancreas surgeons to see whether if we can get patients to exercise, to do more mind-body therapies to prepare for their surgery, and also after surgery, if we can reduce anxiety, improve quality of life, and potential medical outcomes. So our work is definitely really multidisciplinary. We have to really collaborate with the oncologists to ensure the therapies we do are well integrated into the cancer care.
Do you have any websites for herbs or probably some dietary supplements that would be beneficial for patients who are dealing with chronic illnesses or cancer?
So this is a really good question, because a lot of patients want to use herbs and supplements. The only information they can get is often from people who sell those herbs and supplements. And so we maintain an award-winning website called About Herbs. So this website contains 290 monographs about specific herbs and what is intended to be used, where are some of the potential reason why it could work, what are some of the clinical evidence, and also tell patients when you shouldn't be using it. If you're taking certain medications, you should avoid it. So it's a really useful website. Actually, there are, close to over 30 million hits from 228 countries for this website. Also, if you have, smartphones such as, Android or Apple phones, we also created apps. You can download the About Herb apps. So that way you can, when you go to the sort of drugstore or health stores, if you find a bottle of herb, You could take a look of the monograph to see, do you really need the herb? Is this what you are using it for? Certainly, if you are having chronic illnesses and taking medications, I would suggest not only use the website to bring the information to your doctors to have an informed conversation.
So I know you're referring us to this website and patients to this website that are interested in using herbs, but are you ever concerned with the amount of the herbs the patients may opt to take? They're thinking more is better. Is that always the case where, they may feel that, if I take more of this one, I will feel better in some way? Or maybe they should take less. Is that a concern? Dosage?
Absolutely. I think this is one of the misunderstanding. A lot of people feel like if I take more herbs, since a lot of herbs are marketed for health, they will have more health. The answer is no. I often use an analogy. If you use a few drops of shampoo to wash your hair, you have clean hair. If you dump a whole bottle of shampoo in your hair, it will make everything messy, including your skin. Right? So herbs should be treated the same way. I think use judicially, really understand what's the intention of use. It's very interesting. A lot of patients say, I actually have no idea why I'm taking it. My friend told me to take this, and my husband to take me to take this. So I'm taking a lot of things, but I have no idea what it is. I think anything you put in your body, including the food, you have to understand why, right?
Where can someone get in touch with you if they need more information? This is a very intriguing topic.
Yeah, so I think the website is probably the best way. If you Google Memorial Sloan Kettering Cancer Center Integrative Medicine Service, you'll find a lot of our how to schedule appointments. You can find out about our websites. We also have a valuable resource called a meditation station that can help you to do some brief meditation, whether during work or at night when you couldn't sleep. And last but not least, we have this amazing program called Integrative Medicine at Home with 20 live virtual classes. So you can participate from the comfort of your home. I do think those are all the resources we build to help our patients as well as for the broader community so people can be more proactive about preventing illness and staying well with chronic illness.
Well, thank you so much for being here, Dr. Jun Mao, an integrative medicine specialist and the chief of Integrative Medicine Service at Memorial Sloan Kettering Cancer Center. We hope you stay safe and continue to stay healthy and continue to do the great work you're doing.
Thank you so much. It is my pleasure.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.